Hey, good morning, everyone. Dr. Tim here. I want to bust a myth out here. And the myth is most people think that, you know what, disc degeneration, once the disc is gone, then it's gone. Or once the nerve is compressed and you get deterioration of the nerves, maybe you were diagnosed with disc degeneration disease or degenerative joint disease, and it's all over. Like once the nerve is compressed and you can't feel your legs anymore, your nerves don't come back. That is a huge myth. Whoever told you that disc doesn't come back and joint space doesn't come back and nerves don't grow back, you have been completely misinformed. See, a lot of times with your health and your body, it's all about information. Do you have the right data? Do you have the right information? Because for those who believed, and it's easy to believe that because maybe your doctor told you that, maybe WebMD told you that, right? Maybe your friends told you that. Oh, well, once the disc is gone, it's gone for good, right? But it's absolutely not true. See, disc in your spine is it's a living thing, right? It has blood supply to it. It, yes, can degenerate with extra wear and tear, but it is not, here's the other myth, it is not due to age, okay? People say, oh yeah, degenerative disc is just a sign of aging, everyone has it. Well, I've had 80-year-olds come into our practice and their neck and lower back has looked phenomenal, right? Did they have pain? Yes. But was it a degenerative disc problem? No. I've also had 20-year-olds whose disc base were completely compressed. Was it because they're 20-something years old? No. It's not because of that. So the truth behind disc degeneration, nerve degeneration, is that it is caused by an event. An event has to have caused it, whether it's an accident, an injury, is it trauma, is it something repetitive that they did, right? Here's an example. You go to your doctor, you have pain in your lower back, shooting down your buttocks, down your legs. You take an MRI or an X-ray, and your doctor says you have degenerative disc disease, you're 55 years old, you're just getting old. Well, the next question to ask your doctor is, hey doc, which nerve or disc is it? And they'll say L4, L5, right? And then you ask them, how's my L1 and L2? Oh, they seem fine. They're great. Well, then how is it age? Isn't L1, L2 and L4, L5 the same age? That will be the next question to ask your doctor. Why is that nerve so compressed and degenerated, the disc is so degenerated, but the other ones aren't, right? Let's ponder about that for a moment. Why is that? That's because it wasn't age to begin with, okay? It was due to something that you did, more than likely, more than 5, more than 20, more than maybe even 25, 30 years ago. Something happened and it created either a locking mechanism or increased the wear and tear on that specific disc. Now, then the doctor says, well, we can put a cortisone shot in there. Maybe you could do some PT. Here's some medications, right? Let's numb the pain. Well, here's the next question you should ask your doctor. Is that going to fix the problem? And your doctor's like, well, it'll numb the pain for now, but you got to keep taking this medication for the rest of your life. You might have to get an epidural or a cortisone shot every 3 to 6 months for the rest of your life. But then eventually it wears down bad enough and you're going to need surgery. Oh, I didn't know that's how it worked. And your doctor says, yes, that's exactly how it works. Then you have to ask yourself a question. Is that really what you want? Do you want to end up having surgery? Right? Is surgery the end game here? Because if you are thinking about surgery, you might want to ask your doctor, what's your success rate of a surgery? What is the national success rate of a surgery? Some will say 33%, some will say 50%, right? Maybe you got to ask a little deeper. What is your definition of success? Is it completely out of pain for the rest of your life? Is it just a slight decrease in pain in about 12 months? Is it the same amount of pain for the next 3 to 5 years? And that's success. Everyone might define success a little differently, right? You got to ask, how did they define success? The last question I always ask is, hey doc, if this was your mom, if this was your wife, if this was your children, are you going to do the same thing? Are you going to do the exact same thing, recommend the exact same care that you have been recommending me? And see what they say, right? So here's to bust this myth about disc degeneration that can't come back, or joint degeneration that can't come back, or nerves that can't come back. I hate to break it to you, but your nerves can regrow, right? Nerves can regrow. Muscles can regrow. Ligaments and tendons can regrow, okay? Disc can come back, right? Will it come all the way back? No. But can it improve? Absolutely. And just a slight improvement in disc height will ultimately take the pressure off the nerve. Did you know that just the amount of pressure of a dime on a nerve, okay, for more than 10 minutes, the pressure of a dime on a nerve, a dime, okay, how small a dime is, a dime on a nerve for more than 10 minutes can cause an impingement on that nerve and start causing a loss of function of that nerve, right? So then the question becomes, how do you get the disc back? How do you get the joint space back? How do you help the nerves regain? Well, I don't know what others do, okay, but here's the standard in our office. It makes sense to me that when a nerve is compressed between the bones and the disc, the first thing you have to do is you have to do something called spinal decompression to open that joint space back up, right? Now, over time, your back muscles will also lock up to try to protect that area and form scar tissue, which is known as a trigger point. See, muscles are supposed to go back and forth, but when it's locked up, it can't open up. That's where trigger point therapy is going to help, okay? Then the next, if your spine is misaligned, just like your car is, you got to realign it. That's through chiropractic adjustments, right? To increase the healing, depending on how much disc space is actually collapsed, right? You can look at regenerative medicine and or laser therapy to help increase the production of mitochondria, ATP, and boost the healing in that area. Now, will you also have to do some stretches and exercises? Absolutely. You have to do some exercises and stretches. There's no doubt. You have to strengthen the column, the muscle column, the spinal column, your core around it, right? Well, you also have to change your lifestyle. What got you to this point, you cannot continue doing. That is Einstein's way of saying his definition of insanity. Doing the same thing over and over and over again, expecting different results, right? So you have to look at it that way. And of course, you have to eat right. Through about 7-8 different core values that we have in treating disc problems, lower back pain, that's how we have been able to get an amazing results and high success rates. So hope today we've busted through some of the myths in your doctors telling you, oh, once the disc has been degenerated and it's gone, right? Once the joint space is gone, it's completely gone. It's never going to come back. Once the nerves are gone, it's gone forever, right? and you have to deal with this through medications and shots and surgery eventually, right? That is not true. Hopefully you've learned that by today. All right, until next time, if you have back issues, let us know. Give us a call. Get a consultation today. If you have films, MRIs, bring them. If you don't have films, we'll take them. All right, have a great day, guys.